we're using the lobule of the ear. We're going to use the external auditory meatus. It will always be there, even on your burn patients. So that will be the axis. The stationary arm is going to be perpendicular to the floor. And you notice I have it aiming up toward the ceiling, because if we turned it perpendicular to the floor, it would run into acromion. And the movable is going to be the base of the nares. The reference angle of the goniometer is 90 degrees, so you'll be reading from the red scale. So if you would, tip up and look up toward the ceiling. I'm going to get those measurement points and have you relax while I read them. And we have 25 degrees of extension. And now if you would, look down for me. And we're going to measure flexion. And flexion is, relax, 40 degrees. Okay, and we're done. All right, next.
I'm just going to keep recording.
Okay. You tell me when you're ready. All right. The motion we're going to be measuring here is lateral cervical flexion. Your axis is going to be C7. To find C7, have the patient bend their head forward as far as you can. And what pokes out most prominently is the vertebral prominence of C7, so come back up. So that will be your axis point, and your stationary arm is along the spinous processes, parallel with the floor, and the movable will be the midline of the head. So the reference angle and position of your goniometer is at 0 and 180. You'll be reading off the black numbers up here. So what I'm going to have you do is tip your ear over to the left. Now what you have to do is many people with a tight neck will rotate slightly. So just make sure that you are getting pure lateral flexion. I'm going to realign my goniometer, as your book calls for. And she has 22 degrees of left lateral flexion. And then if you would, tip over to the right, making sure there's no rotation. I'm going to realign my goniometer. And she has 16 degrees of right lateral flexion. Okay. All right, next. Oh, did you put your name in your motion?
It's still going.
Okay, now you may want to come around here because I'm going to be actually standing up there.
Yeah.
There.
Oh, never mind. I switch your
Okay, the motion we're going to be measuring here is cervical rotation. The axis is the center of the head. The stationary is aligned parallel with the acromions, and the movable is the base of is the tip of the nose. So to actually see that, you have to have your patient in a low chair, and you have to get on either a high-low table or get up so that you can see the tip of the nose. Now, oftentimes I have a patient put a tongue blade in their mouth parallel and in line with the tip of the nose, so it's easier to see. But in absence of that, you have to get good visual reference. So the starting angle of your goniometer is at 90 degrees, so you'll be reading from the red scale. And if you could, turn all the way over to the left, and I'm going to realign my goniometer. Okay, you can look straight forward. And she has 50 degrees of left rotation, and turn all the way to the right. And now I'm going to realign the goniometer, where she turns much better to the right. Okay, and she has 74 degrees of right rotation. What we're going to be doing now is manual muscle testing for the cervical spine. We're not going to do the positions in your book. Those are going to be very strenuous for your elderly or anybody who actually has a herniated disc or neck injury. So we have an alternative method of isometric testing. So we're going to be testing first for flexion. My stabilizing hand is on the scapula. My resistance hand is on the forehead. My commands to the patient is just hold your head still. I'm going to be applying my pressure gradually and then releasing gradually. Ready? Hold still. 1001, 1002, 1003. And for extension, I'm going to have my stabilizing hand on the clavicle, my resistance hand on the back of the head. Hold your head still. Hold. 1, 2, 3. And for lateral flexion, you're going to be on the same side acromion and the same side of the temple. Hold there. Don't let me push you over. 1, 2, 3. So that was for left lateral flexion. I would go to the opposite side and do the same thing for right lateral flexion. For rotation, I'm going to get behind the patient and just put a hand on either side of the temple. My commands are look forward. Don't let me turn your head. I'm going to first try to turn her to the left and then to the right. Ready? Hold. 1, 2, 3 to the left and hold. 1, 2, 3 to the right. She gets to the right. So the grading of this is either it is strong and no pain, or strong and painful, or weak and no pain, weak and painful. Now, when you were turning to the right, was there any pain? No. So it was weak and painful in right rotation. Weak and non-painful in right rotation. Okay. All right, now we'll stand up and we'll do the